Well, thank you. I want to thank a friend from Florida, the gentleman from Florida, Representative Yoho, and thank him for this opportunity and for hosting this tonight to come by and discuss how Obamacare is affecting folks by home. Consider the case of Bob Joyner, an independent advisor in South Georgia. His wife, Kim, is an audiologist who works in a small practice that does not provide health care benefits. Bob and Kim exercise regularly. They watch their nutrition, and they're fortunate to not have any health problems. They also have a 28-year-old son named Wesley. In 2016, Bob's monthly health care premium increased 134%, and his son's climbed an astonishing 190%. In total, their 2016 annual premiums were $4,285.56 for their son Wesley and $19,026.12 for Bob and Kim. The Joyners should have been hopeful that in 2017 they could change their plan for something more affordable. But thanks to the Affordable Care Act, that wasn't the case. This year, only one Affordable Care Act compliant plan was accessible to them on the healthcare.gov website. An additional policy featuring a high deductible with lower premiums was available. However, the plan was not Obamacare compliant, leaving the Joyners subjected to the Affordable Care Act penalty. Before Obamacare, the Joyner family's annual premium for the whole family, the entire family, was $7,428. At the time, they had access to multiple providers and dozens of plan designs. Unfortunately, Obamacare has brought chaos into the health care system. I want to repeat that again. For Obamacare, the family's annual premium for the whole family, for Bob, for Kim, and for their son Wesley, was $7,428. Last year, just for Wesley, it was $4,285. And for Bob and for Kim, $19,026. Folks, that's just astonishing. That is not right. The Joyners are not alone when they explain that they are unable to save for retirement or pay down their mortgage because of oppressive increases in health care costs. Patients across the country now face this grim reality because Obamacare has failed. Just as the Joyners saw patient costs are skyrocketing, last year, the Obama administration even admitted that premium hikes were coming for this year's health care plans. It turns out the national average premium increase is an astonishing 25%. That's the average. In 7 states, it's more than 50%. Unbelievable. Well, Mr. Speaker, today is a new day. This afternoon, the Energy and Commerce Committee completed a marathon markup of its portion of what was ultimately to be the Obamacare reconciliation bill. It was an honor to be a part of that. 27 hours and 27 minutes we met, and we finally got it out of committee. Now it goes to the Budget Committee, along with the bill that the Ways and Means Committee has sent. So those two bills will be put together, and they'll go to reconciliation. Mr. Speaker, I'm proud to have been a part of this historic opportunity, taking the first meaningful steps toward entitlement reform and Obamacare. I want to thank all my colleagues who are here this evening taking part in this special order, as well as to thank each member of Congress who has and continues to take a stand against the idea of a top-down, one-size-fits-all approach to health care. Our plan presents a better way. The American Health Care Plan will give us access, affordability. It will give us patient-centered health care. Enough of this top-down, cookie-cutter approach that we've had, thinking that everything from Washington, D.C. is better, thinking that we know what the states need. That's not right. What we need is to empower patients. What we need is to have patients in control of their health care system. And this is what the American health care plan does. This is what it does. It empowers patients through health savings accounts, through tax credits, reforming Medicaid. The American health care plan is on its way. I'm excited. I'm excited for America. I want to again thank Representative Yoho for doing this tonight, for hosting this. We appreciate your work. I want to thank all members of Congress who've had a part of this, both sides of the aisle. Thank everyone. Help is on the way. Better health care, market-based health care, where competition and choices will be the case, where insurance companies will be fighting for your business, where you'll have choices, where you'll have competition in the market. That's what we need. That's what's going to bring health care costs down. So again, thank you, Representative Yoho, for hosting this tonight. Thank you.